morning and welcome to our Trillium Health Resources May Provider Forum. Next slide. My name is Linda Holly Isbell and I'm going to start us off today. And we want to talk about how you can engage with us. So first, we are going to have subject matter experts who are available answering questions in the Q&A. So you can go to the Q&A throughout the meeting and answer your question, and our subject matter experts will answer those either during the meeting or at the end of the meeting. If it's a question that we have to take back, we will do so and then include that in the Q&A. At the end of the meeting, we will have a live Q&A session, and you can raise your hand at that time and we will call on you to give your question live. Remember, we have frequently asked questions document posted on our website with the questions and answers from all of our previous sessions, and that is where we will post the questions and answers from this session. Please notice the accessibility features as noted here on the slide. Also, the use of artificial intelligence, AI, any of the features, including but not limited to programs and/or apps to assist with transcription and/or recording during any Trillium WebEx meeting is not permitted. This meeting includes the following features: recording and transcript highlights. Next slide. This slide shows you how you can access the Q&A feature in WebEx. If you just go to the bottom of the screen and look for Q&A, and then click on that and type in your question, and then watch for responses to the questions throughout the meeting. Next slide. Now we'll go over the agenda for today's May Provider Forum. We'll have a welcome and overview and discuss the Trillium's tailored plan. We'll have a presentation about the Healthy Opportunities pilot. Then we'll hear information about provider staff education evidence. We'll talk about how to locate a provider relations and engagement coordinator through the assignment listing on our website. We'll also learn information about where to submit questions through IT tickets. We'll have a provider direct walkthrough. We'll have education and technical assistance about enrollment and eligibility. And then the next slide, please. We have a presentation on housing. We'll hear about the East Point and Sandhills legacy systems wind down. We'll discuss the Fall 2024 Provider Survey and our new May 2025 Summer Provider Survey. We'll provide a response to a question we had about member progress notes. We'll hear information about essential information for physical health providers. And then there will be information about our resources, and we'll have our live question and answer session. I'll turn it over now to Chauncey Dameron.
Thank you, Linda. I'm going to review the overview of a Trillium and tailored plan. Next slide. So Trillium Health Resources is a tailored plan and managed care organization, an MCO, that manages serious mental health, substance use, traumatic brain injury, and intellectual developmental disability services in North Carolina. We specialize for individuals receiving Medicaid through tailored plan. We cover physical health care and pharmacy services as well. And we also help uninsured individuals through state-funded services. We cover 46 counties. The land mass is 28,977 square miles, and the percentage of the land mass in North Carolina is 59.6%. Total population right now is 3,152,058, and the percentage of the North Carolina population is around 30%. Our physical health providers, we have a total of 54,105 providers and 14,103 behavioral health providers. We have 452 vision providers, and our pharmacy and medical supplies make up 2,788 providers. And these counties are covered by all 100 counties, and these providers are covered by all 100 counties. We have a array of tailored plan partnerships, and I'm going to go over a few of them. Next slide. Carolina Complete Health to start is our Trillium standard plan partner, and they're responsible for our physical health network, including the primary care, specialty care, durable medical equipment, vision, long-term services and supports, non-emergency medical transportation, and non-emergency ambulance transportation. Centene Vision Services is our Trillium's vision partner, which is formally involved, and through our agreement with CCH, they're responsible for our optometry network. Perform RX is our pharmacy benefit manager partner, responsible for our pharmacy network, and Motive Care is Trillium's NEMT partner through our agreement with CCH, and they're responsible for our NEMT network. And lastly, we have the North Carolina Department of Health and Human Services, which is our oversight entity, and they're responsible for managing delivery of health and human service related services for all of North Carolinians. And now I'm going to turn it over to Megan to review Healthy Opportunities Pilot. Thank you.
Thanks, Chauncey. Good morning, all. Happy Wednesday. My name is Megan Villette. I'm our AVP of the Healthy Opportunities Pilot at Trillium. I realize this is likely an overview for many of you, but my goal is to give you guys a nice overview of the pilot and a good refresher, and hope if you guys have questions, just let me know. Healthy Opportunities Pilot is a comprehensive program that is geared to test and evaluate the impact of providing select evidence-based non-medical interventions related to housing, food, transportation, and interpersonal safety and toxic stress to high-needs Medicaid enrollees in our 3 pilot regions in North Carolina. Trillium launched HOP in 15 counties on May 15th, 2024. So we are just 1 day shy of our 1-year anniversary of the pilot at Trillium. Members can qualify for the pilot by living in a pilot county. That means that their residential county in NC Tracts reflects one of the counties on your right, to include Beaufort, Bertie, Chowan, Edgecombe, Halifax, Hertford, Martin, Northampton, Pitt, Bladen, Brunswick, Columbus, New Hanover, Onslow, and Pender. They also have at least one qualifying physical or behavioral health condition, which ultimately means they are TCM eligible, and then also one qualifying social risk factor that falls within one of those 4 domains that the pilot is focusing on, to include housing, food, transportation, and interpersonal safety and toxic stress. And we can move to the next slide. I want to talk a little bit about the pilot key stakeholders that are involved in Healthy Opportunities, one of which includes our network leads and also our human service organizations. Across the state, we have 3 network leads, and Trillium is working with 2 of them, which are Access East and Community Care of the Lower Cape Fear. Their primary role is overseeing a network of human service organizations. So their role is to recruit and support those HSOs in our communities that are ultimately supporting our members. Then we also have the human service organizations that are the entities that are actually providing the pilot services to members. And those 2 networks, we have approximately somewhere between 70 and 80 HSOs that are serving members in those 4 different domains that were mentioned on the previous slide. So lots of stakeholders and lots of entities working together to ultimately hopefully provide some good outcomes for our members. Last but not least, another key stakeholder here is Unite Us. They are the owner, the creator of NCCare 360. This is the first statewide coordinated care network to electronically connect those with identified needs to community resources and allow for a closed loop referral. So this is the platform that's used to refer members to the HSOs. So all of that happens across that, that NCCare 360 system. And we can move over to the next slide. I've included here some of our pilot services that are available to members. I think a couple call outs here is, although there are 29 pilot services, that does not necessarily mean that all services are available to all members at any given time. Some of our HSOs do have to close down due to capacity issues and things like that, and could open back up. We also have a couple services that are not offered in both regions. For example, medical respite is a service that is provided in our southern region, but is not in the Access East region. So these are the services that are provided underneath the Healthy Opportunities pilot umbrella. And we can go to the next slide. A little bit of data from the past year. Our TCM providers that are contracted to do HOP in conjunction with our members who are receiving Tailored Care Management at Trillium have been able to enroll over 3,000 members into the pilot this past year. There has been over 7,000 authorized pilot services in the past year, which ultimately means many of our members are receiving more than one HOP service. Services that are utilized the most are our housing navigation service, which is similar to like a housing case management service, our food box services, and then also essential utility setup. We can go to the next slide. So qualifying for HOP, I spoke about this a little bit in the beginning. Like I said before, Trillium members must reside in a pilot county. That means that residential county must reflect one of those counties in NC tracks. As of right now, we have not, we are not aware of any expansion happening this year. That is still on the table. That is something that's being discussed, but we have not been notified of any additional counties under Trillium that would be expanded with HOP. Clearly, that is the ultimate goal, but right now we don't have an update there. In addition to residing in one of those pilot counties, like I said, Trillium members must be experiencing an insecurity in one of the following domains: so food, transportation, housing, or toxic stress. And then Trillium members must have at least one qualifying physical or behavioral health condition. And like I said, this ultimately means that the member is TCM eligible. Trillium members can be referred to the pilot through a couple different avenues. We actually have seen a lot of our members referred from some of the HOP HSOs that they may already have a relationship with, or maybe being supported outside of HOP. So those HSOs can sometimes refer the member directly to the pilot. Members are also referred by their tailored care managers. So our tailored care managers that are contracted for HOP are able to screen and enroll members directly into HOP using NCCare 360, and then request authorization. And once authorization has been approved, they can refer directly to any available HSOs that could serve that member under that authorization. Our TCM entities that are not contracted for HOP are able to refer to our internal HOP team so that the member can be served and screened and eventually enrolled into HOP, and then also referred to services. Members can also self-refer by calling the member recipient line. If the member is connected to a TCM entity that is contracted for HOP, what we will do is we will redirect that member back to that entity so that they can connect with their care manager and talk to them about HOP services. All right, next slide. Included here, just a couple links. This top link is just a list of TCM providers, and it includes an indicator to show which ones are contracted to provide HOP care management for our members. As of right now, the department has put a pause on onboarding new HOP TCMs into the Healthy Opportunities pilot. We are awaiting an update for that to pause to open back up. And once that occurs, we will certainly be reaching out to new TCM providers so that we can onboard additional TCM providers so that they can also link members to Healthy Opportunities. We have another link here. This is to our webpage that shows some additional information about the pilot. There's also a link here to Access East and Community Care of the Lower Cape Fear, which both links have a wealth of information and include some additional details on the human service organizations that are providing the services to our members. So you can find those lists there on those links. And there's also a link here to DHHS and some of just that provides some additional details about the pilot and findings and things of that nature. And also the pilot fee schedule at the bottom, which gives a good overview of and details about the pilot services. And we can go to the next slide. And last but not least, we do ask if folks have questions, you can certainly reach out to HOP TCM support at trilliumnc.org. And we will do our best to get a response back over to you so that you can have what you need. And that is all I have for today. I do see a couple questions in the chat, which I can respond to real quick. I think I responded to the first one, Regina. We have not heard of any updates regarding additional counties that will be added, unfortunately, not yet. Yeah, so Keisha, there is a new point of contact for Unite Us, and her name is Taylor. I am going to see if I can get an email address out to you guys, so I can make sure you have that point of contact. But there is a new point of contact. There's also, you can also submit within the Unite Us platform. You can also submit questions through their help center as well. So that's also an option. Let's see. I think that was it. All right. Well, thanks, guys. I'm going to pass it over to Julie Kakocha so she can talk to you guys about provider staff education.
Thank you, Megan. Good morning. This is Julie Kakocha. I'm the Associate VP of Network Accountability. I'd like to share some information with you today about staff education evidence. Next slide, please. So part of the key role for the network auditing team is to conduct monitoring reviews to ensure that services that are provided to members meet the rules and regulations. So part of that monitoring review includes reviewing the member's record and then also verifying the staff's education and credentials. So review both the medical record for the member and then also some key pieces of information from the staff's personnel record. And today I want to share information with you about some recent trends that we've identified. So over the past 3 to 4 months, there's been a trend that we've received education evidence from the provider that are insufficient. We're not able to verify that the education level of the staff person is authentic, and it appears the staff is not qualified to provide a service. So we're talking specifically about high school diploma, GED, or even college diplomas. So I want to share some information that to make the providers aware that they may receive education verification from a diploma mill. Next slide, please. So you may or may not be familiar with the diploma mill, this term specifically, but the Higher Education Opportunity Act of 2008 defined a diploma mill as an entity that offers degrees, diplomas, or certificates for a fee. So basically, it's a company that sells degrees or a diploma for a price. Second, it requires little or no evidence or any coursework to obtain that degree, diploma, or certificate. We've seen organizations that offer a degree, a high school diploma, that requires only a checkbox that the person verifies that they have the knowledge, and then there is a certificate that is emailed to the individual. Third, a diploma mill is an entity that lacks accreditation by any recognized accreditation agency. And the overall purpose is for these credentials that are used to represent that the individual has completed a program, even if they haven't. So they're generating this certificate for an individual with no valid, authentic diploma or degree or certificate. And this is what we'd like to share with you today. Next slide, please. So part of Trillium and the provider's responsibility related to the education is that Trillium, during our monitoring reviews, and the providers upon hire, verify that the education of the staff that's delivering those services are in compliance with the clinical coverage policy, the service definition, and general statute. So the responsibility is actually verify, not just secure and get a copy of the education for the personnel record, but to actually verify that the education is valid. High school diploma, GED, and college diploma. We've seen the majority of the credentials for high school diploma that appear to be insufficient or not authentic. We have seen one of a college diploma, but the large majority, especially recently in the past 4 months, has been a high school diploma. And part of our responsibility and the providers is to validate that the evidence that the individual is providing is authentic. Also, a main responsibility for both providers and Trillium is to reject evidence where there's sufficient reason to doubt the legitimacy or authenticity of the information and the evidence presented. So a simple validation could be researching the organization online. So we've received some certificates for high school diploma that a simple internet search will show that this is not an entity or a high school diploma that's valid. For example, we received a certificate for a high school diploma, and we simply looked the agency up online by typing in the name, and the first result found was that there was a class action suit against the organization for selling fake diplomas. So when we talk about validating the evidence, there's multiple different ways, but just simply as looking up the agency. And then reject that when you hire the individual, or do more research to see if the organization or the entity is valid. We received recently, as another example, a certificate for a high school diploma with no date, no graduation date. So in order to validate that the person had the degree before they delivered services to the member, we needed to verify that online. Also, we had an example of an online high school diploma from 1980. And that was not a very common practice in 1980 to have online universities or academies. So that's either working with the staff person that is applying for the position and asking for additional evidence if it appears that it's not authentic, the evidence that they're supplying. And also on those online universities or online agencies that give diplomas, there's significant information on their website that'll show that it's not a valid high school diploma. There was an example where we researched the organization because, as I mentioned, there was no date, and directly on their website, they've repeated multiple times, this is not a high school diploma, this is a high school proficiency certificate, which is much different than a high school diploma. They also identified on their website that the certificate most likely will not meet the requirements for college, military, and other government positions. So just researching the agency, if it does not look familiar, will provide you with a lot of evidence. So when the diploma is also not awarded by a accrediting body, or it's not widely recognized, we may choose to investigate further or to simply say that the diploma is not sufficient and therefore the staff is not qualified to meet the minimum requirements of the service. Next slide, please. So today we're providing information just so the providers are aware that this trend has been occurring and their responsibility as well as our responsibility. So when we do request that evidence, if there is some type of reason or question, we will go back to the provider to see if there's additional information or evidence that they have, but we are required from the division to ensure that the evidence that's submitted meets the minimum requirements. Also, there was a joint communication bulletin number 319 in March 6th of 2019. This was the diploma mill and the insufficient evidence was a significant issue in 2019, and the department published a communication bulletin to give more information to the providers and to the LME MCOs. And it's titled Verification of Education, and there's a link there. You also can just do an internet search of LME MCO Communication Bulletin number 319 and it will appear. But this bulletin from the department or from the division identifies some resources that you can use to verify or to confirm that the person that's applying or the staff have minimum requirements, also what the responsibility for the provider is related to education, as well as the LME MCO's responsibility. So there's information there that highlights some of the key points about diploma mill specifically, and then also Trillium support. So if as a provider you have any questions concerning a staff's education or an applicant's education, you can reach out to the auditing team, and there's our network monitoring email address. If you are questioning or you have any type of concern about a staff person and that the evidence that they submitted may or may not be valid, you can certainly email and reach out to the monitoring team. And if you could just indicate in the subject line, it's about the staff education question. This way we can quickly route that email to the staff person or to the team that can confirm that the education is correct and answer questions. Okay. That concludes my presentation. I do believe there was a question in the chat. Let's see. Okay, so the question is, does the provider need to include the actual search information or confirmation in the personnel files for auditing purposes? We highly recommend that you have some type of documentation that you verified, however you verified. We will not ask for that initially when we conduct our monitoring, that we won't ask for the search or the confirmation, but if there is a question, we may follow up with you, and that'll be good information to have if you look the organization up or the entity online to have that documentation also. We won't ask for it initially, but we may if it looks that there's suspicious in any way. And we have seen the trend in the last 4 months, and there are ones that evidence that really look concerning, that, you know, if there's not a date, if there's not a seal, if there's not any type of information that's actually a high school that's somewhere in the country. So you don't need it to submit when we do the monitoring request, but I would definitely keep that in your personnel files. That is a good idea. Okay, let me see if there's any other questions.
Thank you, Julie.
Absolutely. I'm going to turn it back to Chauncey. Thank you.
I'm just going to review real quickly. We do get a lot of questions of where do you find a provider relations engagement coordinator that's assigned to your agency. Just keep in mind that all behavioral health contracted providers are assigned a provider relations and engagement coordinator, and they're here to support your agency by providing any type of technical assistance, sharing helpful resources, and connecting you with any appropriate internal departments for issues you may have. And to locate that, that is on our website under the provider, for providers heading. And then you will look at the contact information and provider portals. You will click on that, and then you will see in a big bold box, it says Provider Relations and Engagement Coordinators for Behavioral Health Providers. So if you click on that, you'll look for your agency's name. And if you are a contracted behavioral health provider and you do not see your agency's name on the list, then you just reach out to us at Network Services Support, and we'll get that squared away for you and get it updated. Next slide. I'm gonna turn it over to Kim.
Okay, thank you, Chauncey. Okay, go ahead. All right, so what we wanted to talk about today in this section is sending an email. We understand that it can be challenging to navigate through case tickets and emails, and I'm just going to share some information that will hopefully help you along the way. So there are several email addresses that one can use for Trillium that automatically convert into a trackable case ticket. When this happens, you will receive a reply email with that corresponding ticket number for your reference. So you would use this ticket number if you're calling the provider support service line about progress of the ticket, or if you have additional questions. As long as the status of the ticket is not closed, you can add additional information or ask additional questions in that one ticket. And that helps us help you by not having numerous tickets regarding the same subject. So what types of questions, go where? So you see here the top, whoops, I'm sorry, go back, please. The top 4 of these emails shown here automatically convert to a ticket. And you see an example out beside it. For instance, Provider Network Services Support. The ticket you receive back will be PROVNET with a number. And then likewise, Provider Direct Support, Claim Support, Contracts, .procurement. The last 2 that you see there are emails, and they do not convert to a ticket. However, you would receive an acknowledgement of the email, and then you would be able to communicate with the receiver of the email asking questions for clarifications. So now you can go to the next one. The next slide. So how do you know which type of questions to send where? So what we've provided here, just a few of the main most asked types of requests or questions for each one of these. So for network services support, requests to add a site or a service, to change an address, anything that is a change, banking information, anything like that, those requests need to be completed by submitting a provider change form to Network Services Support. Any assistance with updating provider information, special rate requests or enhanced rate requests for an entire agency, not just one single member, but the entire agency would go to Network Services Support. Also, individual placement and support, supported employment, value-based purchasing, those types of inquiries. And then for claims, anything regarding a claim status, a denial explanation, issues submitting a claim, questions related to remittance advice or credit memo, and then also claims not paid or not paid at the correct rate. Okay, next slide. For provider direct support, if you need assistance there with technical issues that are within provider direct, if you are unable to complete a member search or a claim search, and another example of what you might send to them would be assistance with system administration, or possibly if your system administrator is no longer an employee of yours and you need to set up a new one. For contracts, the most asked question for them is regarding also technical issues with Provider Direct. They can assist in some aspects. That looks like an error. My apologies. Contracts would not receive some of those. We can go back to the next slide. Sorry. So as I mentioned in the beginning, some department emails are monitored separately. So for rates and finance, the top asked questions that they get is, what is the rate for a specific service? Why are their claims not paying at the correct rate? And what is the status of a special rate request? And that would be for an individual member. Remember, the ones for the entire agency go to Network Services Support. And then questions regarding rate increases for the entire agency. For utilization management, their questions that they get most are how to submit a TAR or technical assistance on how to do that, requesting an update on the status of a TAR, questions about why a request was not approved or why it was only partially approved. They also will respond to questions regarding how to submit an out-of-network request and how to request a special rate or enhanced rate for a single member. Again, not the entire agency. Next slide. So what type of information would be helpful to include in your email, which may or may not become a ticket? So this slide is pretty detailed, but it's best to include information such as, making the subject of the email very descriptive, as in the need, like address need or address update needed, and then you would attach the provider change form or something that's similar to that. So add as much information as you can. And who needs the task is important, because we need to know, is it going to be affecting a member or a provider or an employee at the organization? And then more importantly than even that is, who do we contact if we need some clarification or we have additional questions? Who at your agency or office can we contact? So their name, address, and telephone number. Okay, next slide. And then finally, just be as specific as possible and treat the email that you're sending as if you would be the one completing the ask or the task. And then just a couple of requests from us. If you are sending an email to multiple addresses, just please understand that it may actually delay a response. So if you would contact the provider support service line or respond to the active ticket that you have already, that would be good. And also sending to multiple emails. So if you sent the same question to all of those, copying like all of those or sending it to each one of those in the beginning, it may delay a response, because we need to get together internally to determine who is responding to which part of those questions. Internally, if we have a ticket or an email that goes to the wrong queue or the wrong group or team, we will reroute those internally to make sure appropriate action is taken by the right team. And then finally, prior to submitting your question, we do ask that you go to the provider forum webpage and check on the Q&As. There are a lot of times that again, the same questions are often asked. So we encourage you to do that. And then also we encourage you to use the how do I section under provider information on the provider page. It's just under provider forum. So those are just a couple of additional resources where you can find information, again, to try to help understand and navigate the different ways that you can communicate and ask your questions across Trillium. Okay, thank you. Okay, and I'll turn it over to Stacy Henderson.
Thanks, Kim. Can you go ahead and advance to the next slide? Thank you. Good morning. My name is Stacy Henderson. I am the IT Programs Director here at Trillium, and I'm going to briefly go over how to access our provider portal, Provider Direct. I will also be touching on some commonly used functionality, such as submitting a claim and a treatment authorization request, as well as review ways that provider agencies can reach out to Trillium IT for technical support. Next slide, please. You can navigate to Provider Direct through Trillium's website and then by going to the For Providers page. There are 2 access points from within the For Providers page. The first is a hyperlink that is available midway down directly on that page. You can see this in the screenshot on the left with the red circle. Next to that screenshot on the right is the other option. If you scroll down a bit further on that same page and click on the Learn More button and the purple box for provider contact information and portal, this will take you to where you can access either the Trillium Provider Portal or the Provider Portal for our fiscal health partner, Carolina Complete Health. In addition, once you are successfully logged into Trillium's Provider Direct portal, you can then access Carolina Complete Health's fiscal health portal via a hyperlink. This is displayed in the figure at the bottom of the slide with the orange banner. Next slide, please. Once you are logged into Provider Direct, you will first come to a landing page, also known as your dashboard. From there, if you click on the Client module at the top of your screen in the green bar, this will allow you to navigate to the Client search screen. There are several search combination criteria allowed to successfully search for a member. If you do not use the correct search combination, the system will gently prompt you with a message relaying all the possible search combinations you can use. The client homepage is the hub for easy navigation to complete various functionalities for a specific member. Next slide, please. We're now going to talk about submitting a claim. Claims may be submitted to Trillium by sending an EDI, an 837 file, through a provider secure file transfer protocol, referred to as SFTP, or by one of Trillium's approved clearinghouses, Change Healthcare or SSI Group. For purposes of this presentation, we're only going to review submitting a claim in Provider Direct. You can enter a claim within Provider Direct by clicking on the Claims tab on the client homepage. Once on the Claims tab, you have the option to create a new CMS 1500 or UB04 claim for that member. After you click on the green button for the claim type you would like to create, a box will appear to allow you to select the proper billing MPI. Next slide, please. Once you enter the proper billing MPI, the respective claim type form selected will open up with some key information automatically populated. Once the claim has been completed, you are able to save the claim form by clicking Save and Continue. If there are incomplete fields within the claim form, there will be an error message indicating the number of errors found at the top of the claim form, as well as the related fields needing to properly be completed will be highlighted in red. By clicking Save and Continue, this does not submit the claim to Trillium for processing. You will have to click Submit Claim in order for the claim to be submitted and processed. You will not be able to submit the claim if the errors that are found on the claim form have not been corrected. Next slide, please. You can check the status of a claim for a specific member by looking at the Claims tab under the client homepage. If the claim was submitted through Provider Direct, it will allow you to go into the claim by clicking on the blue Select hyperlink. There are 3 types of claim statuses that will be displayed. Unsubmitted status is when the claim has been saved but not submitted to Trillium to process. Unprocessed is when the claim has been submitted but has not been processed in Trillium's adjudication system yet. And for process status, the claim has been submitted to Trillium and run through the adjudication system and processed. Next slide, please. You can check the details of a claim that has been submitted by clicking the caret to the left of the claim. This will expand the claim line and provide some key details along with the status. Next slide. You can also search all claims submitted by your organization by going to the claim search functionality provided in the green navigation banner at the top of the page. Once here, you're able to see the status of the claim submitted, as well as expand the specific claim to get more detailed information. Next slide. Okay, now we're going to move into submitting a treatment authorization request, also known as a TAR. This is a similar process to submitting a claim. Once you have successfully searched the member in which you want to request approval for services, you will land on the member-specific client homepage. From this page, you can look at previous treatment authorization requests you have submitted, or you can go in and start a new client TAR. You will do this by clicking on the TAR tab on the client homepage. Once you are on the TARs page, click on the green button on the left top side of the page that says New Client TAR. Next slide. The first step in the TAR process is to complete the initial setup of the request you are making. The client information at the top of the page, as well as the provider name, will be auto-populated. You will need to complete the section with the radio buttons, as well as provider contact information. Once you have filled out the necessary areas, click on the Save and Continue blue button. Please note that any field that has a red asterisk will have to be completed in order to successfully save and continue on to the next step of the TAR process. This is applicable to every step while completing the TAR. Next slide. Once you are at the final step of the TAR process, you can go back through the previous tabs to make sure there is nothing else you need to add or change. If all looks good, you can go ahead and complete the fields on the Review tab. You will need to indicate the treatment type, if it is voluntary or involuntary, and or if it's an expedited request. In addition, you will be required to supply a response on the reasoning for why you are requesting the services for the member in the text box at the bottom of the page. Once these areas are complete, click Save and Continue. Once you click Save and Continue, you will see at the top of the screen in the green banner that the TAR has been saved and a TAR number will be provided. This is in the left screenshot, circled. This does not mean that the TAR has been sent to Trillium for review. You will now need to go in and click on the blue button that says Submit TAR to MCO. The top green banner on that page should now indicate that the TAR has successfully been submitted. This is displayed in the circle section on the screenshot on the right. Next slide, please. After the TAR has been reviewed by the Trillium Utilization Management Team and has been approved, you should then be able to see the authorization. Authorizations can be viewed by going to the Authorizations tab on the client homepage, where you can see all authorizations for your agency for that particular member. Or you can go to the TAR module from the main menu at the top green bar in Provider Direct. Hover over TAR and select Print Authorizations. This will allow you to see all authorizations for your organization and not just member-specific authorizations. On either of these screens mentioned, you can click on the printer icon to bring up the PDF version of the authorization to save or print for your records. Next slide, please. Provider Direct includes some great resources and trainings that you can quickly access by going to the training module, which is located in the green navigation bar at the top of the screen. If you run into any issues while in Provider Direct, we recommend quickly viewing these resources to see if there is a training that can assist in self-troubleshooting. If you are unable to resolve the issue on your own and still need any assistance, you can utilize the feedback button displayed at the top right corner of Provider Direct. Additionally, you can contact Trillium's IT department for Provider Direct support by emailing pdsupport@trilliumnc.org. When needing assistance for issues related to functionality within Provider Direct, it is important to only email the PD support email, as adding additional Trillium email groups will result in multiple tickets being created. This concludes my review of Provider Direct, and at this time, I'm going to hand it over to Jamie Dew with our eligibility and enrollment team.
Thank you, Stacy. Good morning. My name is Jamie Dew, and I'm the Eligibility and Enrollment Manager. I will be going over the eligibility and enrollment overview. E&E processes new enrollments, clinical updates, and assists with questions and concerns regarding member eligibility. Next slide, please. In Provider Direct, to look up a member or recipient, click on the Client tab. Minimum search requirements are Social Security number alone, last name and client ID, Medicaid number and last name, first name, and date of birth combined. Please be sure to exhaust all minimum search requirements when searching for the member or recipient. Next slide, please. If you search by date of birth, the member recipient will not display since this is not within the minimum search requirements. And you will see the message above display giving you the minimum search requirements. Next slide, please. If you search by the Social Security number alone, the member or recipient would display as shown below if they are already in the system. If no results are found and you have searched by all other minimum requirements, the member or recipient is not in the system. To view the member or recipient client home page, please click on the select hyperlink. Next slide, please. Once you click on the select, the client home page will appear and land on the insurance tab. This will show you all insurance plans the member recipient is enrolled in, as well as third-party insurance plans. Next slide, please. To view state benefit plans, formerly known as Target POPs, click on the Target POPs tab, and this will show you the Target POP groups. These are for state-funded recipients only. Next slide, please. To submit a client update, click on the Client Updates tab and then click on the Add Client Update. Next slide, please. To submit an enrollment to request state funds, on the top banner in green, click on Enrollments and then click New Enrollment. Next slide, please. Next, you will search for the recipient. If the recipient is already in the system and displays below, from there, you will click on New Enrollment hyperlink. If no results are found, you will create a new enrollment. Next slide, please. For the Provider Direct trainings, in Provider Direct, click on the Training tab in the top banner in green. Under Training Materials, you will find the Client Update and Enrollment Trainings. Click on the select hyperlink to view the training. Next slide, please. Eligibility questions can be submitted to enrollment and eligibility at trilliumnc.org. Thank you, and now I will turn it over to Taleka Williams with Head of Housing.
Hey guys, Taleka's out sick today, so I'm Amy Modlin, the Head of Housing, and I'll be standing in for Taleka. Next slide. So Trillium's Housing Department, what do? We administer federal housing grants. We're always seeking new funding to support an increase in affordable housing since we are in an affordable housing crisis right now. Builds and maintains relationships with public housing authorities and other organizations that offer affordable housing resources. We connect community agencies and organizations.
We're not able to hear you.
To participate in continuums of care throughout our catchment area. Next slide. So what is a continuum of care? This is where we apply for all of the funding that we have in our department. The continuum of care coordinates activities to meet the needs of individuals and families experiencing homelessness. It's a mechanism for agencies to apply for federal funds. It promotes community-wide commitment to the goal of ending homelessness by providing funding for efforts by nonprofit providers and state and local governments, and promotes access to and effective utilization of mainstream programs by homeless individuals and families. So these groups are community groups. It's not a Trillium group. Trillium's just part of these community groups that get together and do all of this work. Next slide. The majority of Trillium's catchment area, 42 counties, falls under the balance of state continuum of care. All of Trillium's current housing programs are under the balance of state. The other two continuum of cares in Trillium's catchment area are Guilford County Continuum of Care and Cape Fear Homeless Continuum of Care, which covers New Hanover, Brunswick, and Pender. The reason all of our grants fall under the balance of state is because these are historically rural areas that don't have the capacity to operate grants. Trillium does have the capacity, and so we've just applied for those under the balance of state. Normally, the other two standalone continuum of cares like Guilford and Cape Fear have the capacity in their area. There are other large organizations that can administer federal funding, whereas the other 42 counties don't have that. Next slide, please. And this is just a map showing you the balance of state continuum of care regional committees. Currently, Trillium operates in 7, 8, 9, 10, 11, 12, and 13. Those are our regional balance of state committees. Next slide. So Trillium's housing programs. All of our programs in the housing department are federally funded from the Department of Housing and Urban Development. One of Trillium's grants has been in continuous operation for 25 years. Seems like a lifetime. All of Trillium housing programs follow the Housing First model and are only accessible through the coordinated entry process. The programs that Trillium administers are permanent supportive housing. Some of y'all that have been around for a long, long time, it was formerly Shelter Plus Care, and you might know it by that name. Rapid rehousing. We have back at home balance of state and coordinated entry. Next slide. I'm not going to go through all this, so no worries. Just the homeless definition that we go by all of our HUD programs are an individual family who lacks a fixed, regular, and adequate nighttime residence, meaning they're living somewhere that is public or private, but it's not meant for human habitation. So think about a barn in somebody's backyard, or we've known people to sleep in the barns you can buy at Lowe's. They've slept in the parking lot of a Lowe's behind Walmart. They can be living in a private operated shelter and a temporary living arrangement like a hotel or motel, but it has to be paid for by a charitable organization or government agency. Also, people that are in an institution for up to 90 days or less and who resided in an emergency shelter or were homeless prior to going into the institution. Family or individual, an individual only needs to meet one of these subcategories to be considered homeless. And then we have an individual who meets the DV definition, is fleeing or attempting to flee domestic violence, has no other residence, and lacks resources or supports network to obtain other permanent housing. Next slide. Who does not meet the definition? Staying with family or friends, staying in a hotel paid for by anyone other than an charitable organization or government agency, or has received an eviction notice but still living in the unit. We get lots and lots of inquiries with people in these situations. We do recognize that these are, dire situations. People need housing that are going through all of these, but they don't meet the definition of the federal grants that we currently have. Next slide. Like I said previously, we follow the Housing First model. Housing First has been, it's a best practice and ends homelessness. People who are homeless need housing, period. That's it. That's what they need first. It's a national best practice. It's not a model. It's not a program. It's quickly and successfully connects individuals and families to permanent housing. There are no preconditions such as sobriety, treatment compliance, and service and/or income requirement. Other supportive services to maximize health stability to prevent returns to homelessness rather than meeting arbitrary benchmarks to permanent housing entry. Housing First is also cost effective. Prior to Housing First and even now, some programs, just say you got to get sober, you got to pass a drug test, you've got to have income, you've got to have this, you've got to have that. But it's really difficult to have all those things if you're living in a shelter or on the street. We don't expect any of that to happen without somebody having a place to stay as their home base, a place they can become sober, a place that they'll be able to get a job, apply for disability, have a regular address. When you go apply for a job and people look at your address and it's the local shelter, they're more likely than not to skip on to the next applicant. So Housing First is the model that Trillium follows for all of these reasons. Next slide. So our biggest program is, and oldest, is our permanent supportive housing. It's similar to a Section 8 voucher for people with disabilities and who are homeless. We prioritize chronic homelessness over, I hate to say just regular homeless, but chronic homelessness is one that's been a long-term duration and the person has a disability. If we don't have anyone that meets the chronically homeless definition, we can go down to people that have been homeless shorter term, but must be chronically homeless, have a disability, and low to no income. This program provides rent and utility assistance based on income, even if there's no income. Scattered site housing in the unit and community of their choice, similar to Section 8 vouchers. Services are encouraged, but not required to participate in the program. The only thing that's required, and it's housing case management through the housing department. And that includes things like check-ins, and those check-ins may be different for different households. Longtime people that have been doing really well may only get a once a month check-in. Sometimes people go through things that they have to do more than once a month. It may be several times a week for some people. During those case management check-ins, if we see something going on, we'll have a chat with them, encourage them to maybe get back into services or maybe start up services or contact a family member or whatever we think would help that person keep their housing. This is permanent with no time limit, although when a person is entered into the program, part of their housing case management is think about coming off the program. And that could be, they may no longer need us, or they move to a different affordable housing program, such as Section 8. It could be a number of things. They've reunited with family and they're going to go back and live with their family. But technically, there is no time limit. Currently in the program, we have about 175 households. That's 300 individuals, 224 adults, and 76 children. It's available in most of Trillium's catchment, but not administered by Trillium in those counties. But there are other permanent supportive housing programs under other agencies, and we can connect you with those. Next slide. Rapid rehousing. We've had this program maybe 6 or 7 years. It's very similar to PSH. It does not require the chronic homelessness definition, only the HUD homeless definition. It's time limited assistance up to 24 months. Currently in the program, we have 11 households, 18 individuals with 12 adults and 6 children. That varies since people roll in and out of this program more quickly than they do PSH. So at any time we could have 15 households or 10 households. It just depends. It's available in most of Trillium's catchment again, but administered by Trillium in Onslow, Carteret, Jones, Pamlico, and Craven. Next slide. This is our newest program. This is all throughout the balance of state continuum of care, but not under Trillium again. This combines permanent supportive housing and rapid rehousing and adds street outreach. We have been thrilled with the results of our street outreach. We've been missing this piece in housing for many, many years. You know, we go to meetings, we talk to people, we create resources, but we haven't had a way to really reach people that are literally on the street, you know, behind Wendy's in Elizabeth City, wherever. Now we have staff that go out on the street, begin a conversation, try to start a relationship with people who often are distrustful of government agencies or nonprofits. Sometimes it takes a long time to bring somebody in, to have them agree to start working with the program. So it's been really exciting to be able to reach people that we've been unable to before. This is initially a 3-year grant. It ends in October of 2026. We are a sub-grantee of the North Carolina Office of Resiliency and Recovery. Again, it includes all counties in the balance of state because it's a rural-specific grant. We currently have actually 125 households, 226 individuals, 148 adults, and 98 children. I love that we help the adults. I really do. But when I see those 98 children, those kind of numbers, it kind of doesn't mean more, but it gives a different spin because I think we're used to seeing, or we normally see homeless adults on the street. We don't often see kids with them for obvious reasons. Adults are afraid their kids will be taken away from them, or their kids may be living with family and friends. Hopefully that's what's happening. So to be able to say we've housed 98 children in this program is really something we're proud of. Trillium's program covers all of those counties. Not going to name all of those, but or read all of those, but then the other counties in the balance of state are also covered under various agencies. Next slide, please. Coordinated entry. This is how you get into those programs. Before we had coordinated entry, it was all about who you knew that was running a program. Honestly, you know, did those people that were running the program, did the person apply and have a special, you know, password or whatever to get their person into the housing program? Coordinated entry has been really, really hard for us to stand up and get going, but it's been more than worth it. So this increases the efficiency in homeless services by standardizing how people access programs and coordinating referrals. So this sets a base for people. People go through the assessment and everybody has the same chance as anybody else. HUD requires all continuum of cares to implement coordinated entry. The balance of state uses a decentralized coordinated entry system with each regional committee. So each of those in that map I showed you, 7, 8, 9, 10, select the model that best fits its resources and community needs. The balance of state has chosen to do the homeless assessment and referral tool, HART for short. This assesses the vulnerability of the individual or family if they continue to be unhoused. This assessment literally assesses how likely is a person to die on the street if they don't become housed soon. Homelessness is a crisis like a natural disaster or any other crisis that we go through, and we try to teach it as such in our housing department. We think about the people that we've lost in the past and think, how about if we could only have gotten them housed sooner? Would we have, you know, lengthened their life? Would they have been able to reunite with family? So yeah, we take it very seriously. Guilford County and Cape Fear use a centralized method, And those COs, continuum of cares, use the vulnerability index service prioritization decision assistant tool. Isn't that awful? VISPADAT for short. It essentially does the same thing as the HART. The balance of state used to use the VISPADAT, but we've switched over to the HART. Next slide, please. So how to access housing programs or ask any housing questions. You can email us at Housing Services. If you're trying to access housing programs, you can give us some information just so we can kind of get a head start, kind of know what you're needing, the name of the household, current living situation, city and county they are located. That will help, that'll assist us in knowing what direction to go with the family, and contact information of the person submitting the request. Someone from the housing department will follow up with you regarding next steps. And again, this will depend on where the individual or family is located. Next slide. So Trillium's housing department is separate from TCL department. We're completely separate. We do not have any emergency funding or housing, period. This is a process. Again, it's kind of similar to Section 8. There's normally a wait because our resources are limited and they do stay fairly full. But I encourage anybody that has someone that they're working with that's homeless to reach out to us and at least get on that community list. We don't provide hotel stays in the housing department, and we only work with independent community-based housing and no group homes or adult care homes. We don't do anything that requires services, that services are included in it, like group homes and adult care homes. I think there were some questions in the chat. Let's see.
Hey, we can just hold those to the end.
Okay, that'd be great. I think that's the last slide. Yep. Thank you.
Thank you, Amy.
Good morning, everyone. My name is Sarah Hodges. I'm an IT project analyst, and I'm here to talk about the winding down of legacy claim systems. So as we all know, Trillium consolidated with East Point and Sandhills in January of 2024. The 365-day timely claims filing period has passed, and we're now seeing very low claims volume. As a result, Trillium is looking to wind down the legacy claim systems. This means that access to the East Point and Sandhills claim systems for behavioral health and IDD providers will end at midnight on Monday, June 30th. So this means that the provider portals for East Point's Alpha Plus system, East Point's iTransact system, and the Sandhills Alpha Plus system will be affected. This also means, oh, I'm sorry, I must be speaking too quietly. All right, so just to make sure that everybody here heard me before, because of consolidation, now that we've passed the 365-day timely claims filing period, we're seeing very low claims volume coming in for East Point and Sandhills. So we're looking to decommission the legacy claim systems effective Monday, June 30th. So that'll affect the provider portals for East Point's Alpha Plus system, East Point's iTransact system, and the Sandhills Alpha Plus system. This also means that access to the East Point and Sandhills FTP sites will end at midnight on Monday, June 30th, meaning that integrations with claims clearinghouses and vendor partners will also end on this date. So if you have used clearinghouses such as Change Healthcare or SSI Group to send claims to East Point and Sandhills, we will no longer be accepting claims through those clearinghouses as of June 30th. We encourage providers to prepare by submitting retro Medicaid claims for dates of service January 31st, 2024 and before for East Point and Sandhills now. And we also encourage you to export any documents such as RAs. After the system decommissioning, as of Tuesday, July 1st, providers must reach out to claims support to submit claims for legacy East Point and Sandhills. A claim specialist will be happy to work with you on any retro Medicaid claim submissions. Again, claim submissions that come through claims clearinghouses will not be accepted from July forward. That said, no changes will be made to current processes for Trillium claims, and Provider Direct will not be affected. Thank you. I'm now going to pass things to Linda.
Thank you, Sarah. I'm going to start out and talk a little bit about the fall provider survey we did, and then the next agenda item is we're going to talk about the new one. So if we can go to the next slide. So last fall we conducted a survey and we asked providers, we gave a list of topics for providers to identify as the top ones. And then we also included a section where providers could write in topics that were important to you for us to provide technical assistance and education on. So on the screen are the top 7 topics that providers identified for us. And as of today, we have finished presenting on all of those. Today, Stacy went over the Provider Direct setup, and that was one of the items that providers had asked us to provide technical assistance and education on. We've also been talking about other hot topics throughout the provider forum since we started in February. So we really appreciate everybody that completed that survey. It really helped us identify what's important to you. We want to hear from our provider network about what we can do to provide technical assistance and education to assist you. So if we can go to the next slide. So now we're ready to do a new provider survey. We want to know what is going on now that we can assist you with. So if you can go to the next slide. So we opened up a survey last week. It's called the May 2025 Summer Provider Survey. We are going to run it for 30 days, so it will go into the first week of June to make sure we give all of our providers an opportunity. And I'm going to ask Kim or Chauncey to put the link in the chat for you. It's a quick survey. We want to know, again, how we can ensure that we provide technical assistance and education on topics that are relevant and important to our providers and our network. We have been doing these provider forums now since February, and we know that things change and your needs change. And so we want to get input from you about what is important to you, what your expectations are. There are 3 quick questions. It won't take more than a minute to complete. You can let us know of a list of topics, which ones are priority, and then you can also write in again. So we took information from questions that we've been receiving from providers recently to list the topics for you to give us feedback on, and then you can add in anything at the end. So we really want to hear from you. Kim has put that link in the Q&A. So if you want to go ahead and click on it while you're in the meeting today, we'd appreciate that. We want to get as much information from our provider network to know what direction to go in providing these presentations. There's been so much good information shared from our internal Trillium team and our CCH team working together to make sure we're meeting your needs. We got a lot of feedback when we did consolidation and had town hall meetings from providers. And since then, we're using the survey to collect that information from you. Again, we want to hear what's important to you. We want to provide that technical assistance and education. So please complete that quick survey and give us that feedback, and we'll start providing information and technical assistance going forward on those topics. Next slide. I'll turn it back over to Kim.
Thank you, Linda. We're going to just talk about one of the questions that we received at a previous forum, and we were asked to acquire some information and share that. So this is regarding progress note documentation guidance. And you can see here that we have listed 2 sites for you. The first link will take you to program-specific clinical coverage policies. The second link is to the Records Management and Documentation Manual. If you do click that link and go there, you'll see the current version of the documentation manual, which is in effect through July 7th, 2025. And then directly underneath, you will see the one that will go into effect July 8, 2025. So hopefully that will give you guys some of the information you were requesting regarding progress notes. Next slide. Okay. And now Jessie Harden will present for physical health.
Hi, good afternoon. Thank you so much. We can go to the next slide. So we've reviewed this information, but definitely important to share again. This is when you are working with a third-party billing entity. So they may not be someone who is staffed at your practice, but someone that you work with to do the billing on your behalf. These folks are absolutely able to get access to the physical health portal for Trillium. And there's an easy way to do that. So if the practice is already set up on the secure provider portal, then you should also have an account manager enlisted in that portal. That's typically someone in your practice who is able to add or remove existing users from the portal account. So someone who is really in touch with the staff and who should and should not have access. So this person can invite a user by sending an invitation to the email address for that third-party biller. That person will receive an email and it will bring them to the create an account page for the secure provider portal. Here they would verify their email, and once they do that, they'll come back to this login page and it will prompt them to enter the tax ID number, phone, and fax. An important note here is that the TIN is the one associated with the contracted practice. So please do share that if you are having a third-party biller register for the portal for your agency. At that point, the practice portal account manager at the practice can then verify that person and give them full access to the portal. And you can also check off what levels of access they have. So for instance, a biller may need access to claims, member eligibility, for example, and you can discern that when you verify their account registration. Next slide. We also like to use these forums to share the most recent claim denial trends. So that's what you'll see listed here. If you see these explanation codes come over on your explanation of payment, we have provided some guidance and where applicable, some additional resources for you to use to work through that denial or perhaps just prevent it from happening in the future, some tips and tricks. The first is regarding when the claim requires a primary EOB or obtaining a prior auth first for the service to be considered under EPSDT. The second, also related to the primary EOB. So this is when the patient has a primary insurance and Trillium Tailored Plan is the secondary payer. In the physical health portal, there is a way to submit this coordination of benefits claim. We've linked a provider guide here that will walk you through how to submit that claim with the primary insurer's EOB. And we do recommend providers use the Trillium Physical Health portal to verify if there is other health insurance. The third is non-eligible or non-reimbursable service. So that is based on the member's benefit plan or regulatory guidelines. We do think that you can still contact our provider services team for clarification. Of course, if there is something that we need to look into, our team is happy to do that. The next is around the billing NPI or taxonomy, if it's not on the Medicaid file or not active on the service states. So the most important takeaway here is that NC Tracks is the source of truth when it comes to provider data and credentialing status. So it is extremely important for all providers to ensure that that data and credentialing information is up to date and accurate on NC Tracks. The health plan receives that information from the state daily, and that is what is used to verify your provider data when you're submitting a claim. If you perhaps forget to put that taxonomy number on the claim, that would be a different denial, but wanted to just mention that here as well, since we're talking about taxonomy. That is a common cause of delays and denials. And so again, you should include the taxonomy, and that should also match with what is in NC Tracks. If you use a clearinghouse, we do encourage you to work with your clearinghouse to make sure that the taxonomy placement is a permanent change on your account going forward. And there is a provider guide here as well, which helps you see where exactly on the claim to put that taxonomy number. The last trend that we're seeing right now is the referring provider MPI is not on the Medicaid file or not active on the service date. So similar to what we mentioned a moment ago, the NPI provider data should be active with credentialing status through NC Tracks, and the data that is in NC Tracks must match what's entered on the claim. Next slide, please. So we also wanted to share some information about upfront claim rejections. On the right here, you see a little snip from a provider guide we have linked, which does list out some common causes of upfront rejection. So this is when the claim is not even accepted into our claims processing systems. That is called a front-end rejection. You may receive a tracking number when you submit that claim. And you might find that later on, you're not seeing that claim in the system, and that's most likely due to a claim rejecting. However, you will get feedback on every rejection. Each rejection has a reason code with details that you'll receive upon claim submission if you're using the Trillium Physical Health Portal or a clearinghouse, and you should resubmit the claim with corrections to resolve that rejection. You also will receive a rejection letter in the mail, including that information with the reject code and the reject reason, whether that's submitted on the Trillium Physical Health Portal or through your clearinghouse. So you would need to review the claim submission and submit a new claim to resolve that rejection. That's how you would make a correction to a rejected claim, is to submit a new claim and resolve any issues or errors that were noted based on that original claim rejection. Next slide, please. Lastly, we wanted to remind you about our communications and other provider information session forums. So first, we have our provider communications page through Carolina Complete Health Network, which is linked here. You'll see all of our previously sent provider communications. If you are not receiving these, we do have a sign-up form located on that page or linked here. It's a quick survey monkey just to indicate that you would like to be receiving those communications. We typically will grab email addresses that you use during contracting, but understand that there are other folks within your practice that can and should receive these communications as well. So don't hesitate to sign up. And then our provider information session, these are more orientation style. We host these the fourth Tuesday of each month at noon. Great for new providers or new staff in your agencies, or if you simply would like a refresher, we do encourage you to register for these. And we do have those slides and a recording posted as well. Okay, you can go to the next slide and I'll pass it back to Kim Wagner with Trillium.
All right, thank you, Jesse. We just wanted to remind you of how to register for the future forums, but also how to review previous forum information. From the For Providers page, if you go to the provider information section, which is that third column, you will see provider forum at the bottom. Just click on that and then it will open the available past forum information sections. There will be the Q&A. There will also be the presentation as well as the recording for each one. So those are available for February, March, and April thus far, and we will submit the May information as soon as we can get that available. Next slide. Okay, And then this is your time to ask questions. If you have a question that you would like to ask, if you would raise your hand, and then Jonathan will be able to allow you to unmute yourself and you can ask your question live. Or if you have questions you would like to put in the Q&A, you can do that also at this time.
Got 2 hand raises so far. Lindsay Lawrence, I'm going to go ahead and send you a request for unmute.
Lawrence VA here. I own Making Waves Mental Health, and I've been credentialed with Trillium for quite a few years now. And I had a question about taxonomy codes, actually. I have been struggling with getting my claims. I'm a behavioral health provider, and I have noticed that I haven't had any claims reimbursed since December, and have been working to troubleshoot this issue since then. And I've learned that the latest Trillium provider manual shows the PA taxonomy code as a physical health taxonomy code. So I've had people recommend I submit through the Carolina Complete Health portal, but then the claims get rejected because I'm using behavioral health ICD-10 codes. So I'm hoping that coming straight to the source, anybody can offer suggestions on how I can go about submitting claims for as a PA, as the billing provider, or if there's a way to get that updated in your system somewhere, so that way PA taxonomy codes can bill for behavioral health claims, because this has been tough.
Lindsay, this is Linda. We don't have anybody on from claims today, but if you can put your name and email address in the Q&A, Chauncey can find out who your assigned coordinator is, and they can reach out to you and get the specifics and connect you with claims.
Well, so my provider relations and engagement coordinator is Andrea Gonzalez, and she was the one who recommended I log into this webinar today.
Yeah, we're really glad that you, okay, great. So you know who that is. Chauncey, can you follow up on that and see how we can connect her to get an answer to that question?
Yes, if you could email Andrea directly and let her know that you pose this question in the forum, we can route that internally and get on it.
Yeah, and just so you all know, we don't have subject matter experts on every subject with us today. We do for all of the presentations we have today, and we're very happy to have Sharon Trowell with us from Utilization Management. But there may be times when you have a question and we do not have somebody on that can answer it, but we can definitely work with you to get that resolved, because we want to see your claims be able to be processed, Lindsay.
Oh, cool. It looks like someone else has experienced this too. Oh, this is a huge issue. So yeah, it took me a long time to notice it and finally get answers, because I'm the only one at my practice. So it sounds like whoever made the decision to list PAs as a physical health only taxonomy code isn't knowledgeable in what PAs can do. So thank you very much. I've reached out to Andrea. I hope to hear from you guys soon.
And thank you to, I haven't seen I saw it pop up, but I haven't read the whole, statements from the other folks. We'll take that back as an issue and we'll look into that, and then we'll bring somebody to talk about that, next month.
Great, thank you.
Thanks, Lindsay.
Don't mute myself. So next up, we have Josephine Okiki. I hope I'm pronouncing your last name right. And just so everyone knows, when that request for unmute comes, it can take a second for that audio to pick up. So maybe just wait a beat or two, just so you're not cut off. We've got Josephine up next.
Good morning. I've just waited a beat just to make sure that you all could hear us. So my question was more so for the housing. Can you all hear me?
Can you hear us?
Yes, we can hear you.
This is Merciful Hands Day program.
Okay, so we jumped on a little late. I just wanted to get some more information about how to access some of the programs. I took notes, but I just had some clarifying questions. For the permanent supportive housing, the PSH, is that program open to anybody? And how do they get access to it?
You can send a request to the Housing Services at Trillium email, and yes, it's open to anybody who is defined, meets the HUD definition of homelessness. They have to be homeless.
Got you.
And you can ask us anything in that email. We've got several staff that monitor that email address, so we'll be sure and get right back to you with any questions, clarification, or whatever you need.
And then so for the rapid rehousing, is the contact the housing department, the email you just gave me, the same for all of the programs that were covered today?
Yeah.
Okay. So any questions I have, I can just hit you all.
Yes, you sure can. Please do.
Okay. And one last question. That HEART, the assessment tool, and EISPADT or DAT, is that a tool that we have to download and use?
It depends on what we'll give you. It depends on what the situation is. In some situations, we do it internally, and others, Colin does, but it's nothing. We'll walk you through that process, though. It's nothing complicated, I promise. It's like 1, maybe 2 pages.
Okay.
Yeah.
Okay.
All right.
One more question, please.
Uh-huh.
I have a question. It's somewhat similar to what the question that Ms. Dina was asking you. Do y'all help staff the day program? Do you have a program with that?
We don't in the housing department.
Okay. That's nice. Okay, thank you.
Okay, that's all. Thank you so much.
You're welcome.
All right, next up we have Katrina McKinnon. Oh, I thought. Katrina, sorry if I accidentally lowered your hand. If you just want to raise it again, if that was me. Sorry about that. So next up we have Antoinette C.
Hopefully everyone can hear me. I just have a question about claims. I realize there's no one on this particular call, but there seems to be an ongoing issue with claims not being received or paid. We work with our software provider, EHR, EMR provider, Patagonia. We talked to them and they acknowledge that they have other behavioral health providers who also have an issue. And they have consistently said the issue is on your side. And so what happens is it causes a lot of issues with claims being received, being paid. And so that contributes to, of course, financial hardship for practices, trying to serve the community. I just wanted to see if there was guidance or if there's any issues with claims being received into the system, or if any other providers have also encountered this issue.
It was a little, this is Linda. It was a little hard to hear. But I understand you're asking some about some claims issues, and do you know who your behavioral health coordinator is that's assigned to your agency?
Yes. I do. It is Cameron,
Okay.
and we're also speaking with Cameron as well.
Okay. I think because we don't have someone on from claims, we're going to have to follow on that. So if you can put your question in the Q&A, we'll follow up with you. We'll follow up and put that in the Q&A document. And then please feel free to reach out to Cameron, and she can also assist you.
Okay.
Thank you for
Thank
your
you.
question.
Be sure to put your name and your agency also besides your name, so we'll know how to go directly to.
Okay, thank you.
Next up is Christia Irving.
My question has to do with TAR partial approvals. So historically with innovations plans, we do plans through birth months for a plan year. And more recently, we have been getting denials from Trillium, and they're just doing partial approvals and only approving the plans we submit through the date the plan was signed, which causes problems with the following year because then we have to start a plan basically like at least 14 days, get it signed before the plan expires. So it's overlapping plans. And submitting a plan when someone signs it, we don't know what date they're going to sign it. Some people we use DocuSign, but if they don't sign it for 3 days after we say it's a 6/1 start date and they sign it 6/4, it puts our plan dates all off. So I was wondering if anyone had brought that to the attention of Trillium and tried to problem solve that situation.
Thank you for your question. This is Sham Trow, the UM director. I'm getting ready to put my email in here. Please send me an example of that and I'll have my team review it and come back to you with an answer for that. I need to look at that specific example.
Okay, we have a few of them, but I'll just send one. Did you want me to? What email do you want me to send that to? Oh, you just put it in the chat. I see it.
Yeah,
okay.
I did. Please do. Thank you so much. Securely. Thank you.
Thank you.
And before we go forward, Jonathan, with the next one, I know we had an outstanding question from the last one. And Sham was going to share a response with us. Sham, do you want
Yeah, I'm happy to. We had a couple of questions. I guess the best thing to do is just read these. We've had a couple of outstanding questions really related to TCM that I'm in here working with our TCM and our Trillium team to get these questions answered. So there seems to be a disconnect that providers need to have ISP documents completed and signed in order to submit the TAR. And this must be submitted 14 days prior to the start date. We have been reaching out to Innovations Waiver Care Managers with Trillium since 2/1 for ISP start dates 3/1, and they did not have the ISP signed, let alone sent for review. Since Trillium does not use DocuSign, care managers are going out to homes or mailing the documents for signature, which is creating a lengthy process and restricting our ability to receive authorizations. We just sent an ISP out via DocuSign today, 2/13, because the legal responsive person has not received the ISP in the mail to sign yet. It should not be the responsibility of service providers to facilitate getting these signatures in a timely manner. And the response for our TCM team is, it is a responsibility of Trillium's care team member to obtain signatures for ISP documents. In the event assistance is needed, providers will be asked to support obtaining the signature. If there are specific concerns related to signatures, please outreach the care manager supervisor. And that's Becky Arnett. And I'm happy to include that information. This is a series of 4 questions, so I can include that information in the chat as soon as these questions are over. The second question is also around ISP documents not being sent to the team for review before getting signatures. This is a problem if they were correct, but more often there are issues with unit calculations, weekly hours of service, and justification of services. When providers submit the documents to UM, a request get UTP when there's discrepancy in the documents and the TARs. And so TCM's response is ISP should be accurate before obtaining signatures. If not, the ISP should not be assigned. Discussions around units, weekly hours of service, and justifications should be discussed during care team meetings. The third question is, each provider is having to upload all clinical documents into Provider Direct for each authorization, as we cannot see what has been uploaded by other team members or is available for UM to see. This is a massive duplication of efforts. Additionally, providers might not have all the documents that UM is requesting to review. For example, SIS evals and budgets are documents that are not always sent to providers. And the response from TCM is, if there are documents a provider needs, please request from TCM. The last question is, when UM needs additional documents or sends a clinical recommendation, this is being sent to the service provider only. I confirmed with UM via email. They told me that they do not send this information directly to the care manager, despite them being told that this is their role. The UM clinician, this is the answer, this is the response. The UM clinician documents recommendations in the provider comments tab. These will be visible to whomever submitted the TAR, whether it's the TCM or the provider. I'm happy to put this in the chat, or it might be better just to include in the minutes from this since it's kind of lengthy. I will put Becky Arnett's address in there in case folks have questions related to TCM and need information from the operations director. Are there questions related to that?
Thank you for providing that, Sham. We will add that to the question and answer for this this session for May. And Sham has put Becky Arnett's email in the chat with the Q&A. Kim and Chauncey, do we have any unanswered questions in the Q&A we need to bring up?
I only see one question in the actual Q&A. Actually, there's two. Diana Campbell had asked, is Access East still working with Trillium? When they call, they tell you that they're not working with Trillium. I'm not sure if anyone on the panel can address that one.
We'll probably have to take that back. I don't think we have anybody on that can answer that one. What's the next one, Kim?
Next one is from Deborah Jordan. Has there been a policy change that affects the anniversary date of the innovation waiver recipient's service hours? For example, if the birthday month is February and renews on March 1st, does the new hours to include respite start then or at the year-end date?
There's been a policy change on this, unless you're referring to a 1915 authorization, and then that date is not parallel to the innovation's birth date. It is parallel to the eligibility date. And there have been several questions sent to the department about this in hopes that we could get this all on the birth date. And that has not been worked out, unfortunately, and not related to any of Trillium's decisions.
Thank you, Sham. Is that the last one in the Q&A, Kim?
Yes, that's all I see.
Okay, let's go back. Jonathan, do we have any more hands raised?
Yeah, we've got two raised hands. Try and get those up. That's distracting. Next, we have one question from Morgan.
A bit of confusion on the provider side. Exempt, no TAR submitted for annual service. Can you guys give us is that starting to start July 1st when TAR is supposed to be submitted for new services? Or I think there's just a lot of confusion regarding the TARs and submissions.
You broke up just a little bit. So flexibility is in for innovation services starting July 1. So anybody with authorizations needed for July 1 is what we would expect. Let me refer you back to the clinical communication that hopefully is a little bit clearer. Hold just 1 second. And if you have specific questions related to it, I can put my email in the chat again. And you can reach out to me directly. I'm happy to answer. This clinical communication 75.
Okay, thank you.
Uh-huh.
All right.
All
Any?
right.
Oh,
Go
please.
ahead.
Go ahead. I was just going to say, are there any others?
Yeah, we got 4 raised hands. Next up is Kim Friend.
Just a quick question, or I guess this comment, just regarding what the response that Sham Trowell just read out. I appreciate the response from the TCM staff, but just as a provider, and this is across all of the LME MCOs, those type of responses are really frustrating, because when we get policies or rules or whatever spit back at us, like, we already know that, but we're asking the questions because it's not happening that way. And so I just want you all to know, like, that's not helpful. And I think what really would be helpful is to have some kind of forum where providers can pose questions, and with actual, like, TCM, care management, whatever, on a call, so that we can say, this specific issue is happening, but it's happening all over and over. I know what the policy says, but what are we going to do about fixing it because it's an issue? And then my last comment is just, and again, this is an MCO issue. It is extremely difficult to get in touch with people at the LME MCOs. As a provider, having to call and talk to, like, the client member service representative who is, chit-chatting on texting with some supervisor, an expert or something, like, it's so frustrating. If we could just have a 5-minute phone call with people, if things could get solved so much faster. So I understand why a large agency would implement something like that. However, from a provider standpoint, it's really frustrating. So I just wanted to put that out there. Thank you.
I appreciate the honesty. This is Sham again, and acting for TCM now. I hear you loud and clear. I will say, for what it's worth, with this email came training internally for our TCM team. I took it to their representatives and they said, oh, we need to do something different here. So they're aware of it. I know they're working on it. Is it great? No, I understand that. And I hear you with wanting to talk to people. We do hear that often. We are doing the best job we can with tracking it. With such a large agency in so many counties, we try really hard to track our responses to make sure we're responding in a short amount of time. My email's out there. I'm happy to answer questions the best I can, or to link folks to stuff as fast as I can. But I hear you very loud and clear. And I will also take that message back to the TCM team.
Thank you. Appreciate that.
Yeah, Kim, this is Linda. We definitely hear you. That's one of the purposes of this call, is to hear what the providers are going through, how we can support you. And we'll take that back to the TCM team. If you have a specific question that maybe the provider relations and engagement coordinator can assist you with, you can always reach out to them and they can work with the TCM folks on trying to resolve that and get you an answer. So if you're not sure who that is, you can use those instructions that Chauncey gave earlier, or put your name and email in the chat and Chauncey can follow up with you.
And I recommend Becky Arnett also, an email I gave out earlier.
Thank you. Yes, that email is in the chat, so please feel free to reach out to her. So we've got 5 minutes left. Back to you, Jonathan.
All righty, got 3 more hands. Next up is Deborah Jordan.
everyone. I just wanted to be clear about what question I was asking about the client's anniversary date. Been in a situation where the plan renewed on March the 1st, and the person billing has been denied, said it exceeded yearly unit. Someone named Amy sent out a response that it corresponded with the year-end date for Trillium. I just want to be clear because it was a typo up there. My fingers went faster than my brain, I guess, on my and so I just want to know, has there been a change that I'm not aware of? Because with the innovation waiver, I thought the anniversary date was their anniversary date, and that dealt with the consumer's birth date.
Hey, Deborah, the anniversary date remains the birth date. I'm not sure why for the claim denial. I'm happy to look at that, and I'll put my email in here again. That's for no prior art. That makes me think it's something related, maybe related to something we're not sure of right now. So send it to me. I'm happy to have someone on my team look at it.
Okay, where's your
I'm put it in their chat right now.
Okay, I appreciate it. And you are?
I'm Sham.
Sham, hi Sham. So okay, we'll look forward to communicating with you about this, because this is the second time it's happened, and I had to get involved they released some kind of date or flag on something, some kind of flag. So, all right, Sham, thank you.
And real quick, this is Linda. I just wanted to say I saw a question about whether the provider relations and engagement coordinators work with providers on issues in all counties. They do. That is the assigned for all behavioral health providers. There is an assigned provider relations and engagement coordinator. And then on the physical health side through CCH, there are also provider service staff assigned to all of the physical health providers. So please reach out to us if you have questions about that. And we've got 3 more minutes. Back to you, Jonathan.
Oh, thank you all.
And we got Liz up next.
I don't know if anyone's on the call that can answer this question. We are having an issue with getting our IPS supported employment claims paid. We are frequently getting denials of our 1915I approved clients. It's only with Medicaid that is stating that the denial is due to an incorrect place of service, although it's the same place of service we've been using for years providing the service. I've been going back and forth with claims department for months. Today I was told it's a issue, that there's a problem with the authorization, but this service doesn't require authorization. So we have several thousands of dollars outstanding. And it's only started since February of this year. So I wanted to check in, see if there's someone direct that I can speak with, to see what we can do about getting these claims resolved.
Liz, this is Linda. If you can put your name and email address in the Q&A, I'll get somebody to follow up with you.
Will do. Thank you.
And if the last person said it was a issue, if you want to send me securely an example or two of it, I can have my team review it and help also. This is Shane.
That would be great. Yeah, Sham. I actually sent an entire spreadsheet to the claims email today or yesterday, and I've been going back and forth with them, like I said, for a few months about trying to get it resolved. So I appreciate that.
Do you know who you reached out to?
The person I spoke with today that told me that our place of service is billable and it is now an issue. Hold on, let me find it.
Maybe we need to chat offline. I didn't mean to take us down there. Just shoot me an email, Liz, and we'll work together to help make
awesome.
it fix it. Thanks.
Thank you.
And we have one final question, because I know we're at noon, from Joy Schultz. There we go.
Hello?
Go ahead with your question, Joy.
Are y'all hearing me?
Yes, we hear you.
Okay. I know I missed this in the beginning. Will we receive a copy of this PowerPoint? And if so, how can we request it?
So on our website,
Or do we need to request it? I'm sorry.
no problem, Joy. This is Linda. On our website, under the provider page, we have a link now for provider forums. And you can go there and see the recorded version of all of them. You can see the PowerPoint and you can see the Q&A. So just go to our Trillium website at the top, go over to, I think it's the third one over, that says provider, click on that, and then you'll go down to where it says provider forum.
Okay.
And we'll be posting this one there. Right now you can see the ones from February, March, and April.
Okay, I did hear that. I'm sorry.
No worries. Glad to help.
I wasn't sure about today's though, but thank you so much.
Yeah, it'll be posted in the next couple of days.
All right, thanks.
You're welcome. Well, we want to go ahead and wrap up and thank everybody for attending. The purpose again of these meetings is to provide education and technical assistance for topics that are important to our providers. You are our provider partner. We work together to make sure our members receive the services that they need. So please feel free to reach out to us. Please take that survey. Use that link that's in the Q&A that Kim put out there. And let us know other topics that we can present on to assist you in the future. Thanks again and hope you all have a great day.